Latest data from NCDC puts number of COVID-19 confirmed cases at 5. Latest data from NCDC puts number of COVID-19 confirmed cases at 541, and tributes pour in for late Chief of Staff to the President, Abba Kyari. COVID-19 confirmed cases in Nigeria now stands at 541, 166 discharged, and 19 deaths, as at 40 minutes past 10 o'clock in the evening of the 18th of April. The breakdown of the cases by state is as follows. Lagos State has 306, while FCT has 81, Kano State has 37, and Osun State 16. Edo State has 15, while Ogun has 12. Kwara and Katsina States have 19 each. Bauchi, Kaduna, and Akwa Ibom States have 6 each. Delta State has 4, while Ekiti and Ondo States have 3 each. Enugu, Rivers, and Niger States have 2 each, while Benue and Anambra have 1 each. And away from the COVID-19 update, the remains of the late Chief of Staff to the President, Abba Kyari, who died on Friday in Lagos, has been interred. State House correspondent Adamu Sambo reports.
He died Friday night from COVID-19. The late Chief of Staff was tested positive for the disease shortly after his return from Germany, where he represented Nigeria to meet with officials of Siemens on the expansion program of the nation's power sector. Malam Kyari's passion for a prosperous Nigeria and indeed loyalty to President Muhammadu Buhari, many say, were never in doubt.
Hate him, love him, but you can't question his loyalty to his boss. His loyalty to his boss was unquestionable, was unnegotiable, and he was literally the punching bag. And he bore stoically all the insults, all the accusations, malicious concoctions, and dubious aspersions on his person. He was a great stoic man.
He had the interest of this country at heart, and he was able to make whatever sacrifice was necessary for this country. Great loyalty and unimpeachable integrity. And for years and years and years to come, people will realize just what an impact he has made. And in his loss, we will now begin to see exactly how important he was.
We worked together. He was my editor in the newspaper industry, and we worked very closely. He's a very hard-working person, honest, sometimes temperamental, but for our cause. And many people misunderstood Abba, and may God forgive him and give him Al-Jannah Firdausi. We lost.
But what lessons are there to learn from the demise of the Chief of Staff to the President, Malam Abba Kyari, from the novel coronavirus? A question posed by NTA News to the Chairman, Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, Boss Mustafa.
One of the key lessons for me is that this thing is real and it has come home. How closer can it be to us than this? And that's what I keep saying, that we should not play with this issue. It's not a joke. It has come to ravage our people, ravage our health, and ravage our wealth as a nation. So we must take it more seriously. And the advisories that have gone out there about social distancing, about staying at home, they are not punitive. And I continue to emphasize that they are not punitive. They are meant for our good. So it's a big lesson that our people should not play jokes with this.
In a statement by Malam Garba Shehu, the presidency says no condolence visits will be allowed, but people are instead advised to pray for the repose of the soul of the late Chief of Staff. And for those that can utilize the window permitted for movement in the FCT, a condolence register will be opened at the SGF's office from Sunday. From the State House, Adamu Sambo, NTA News.
President Muhammadu Buhari has sent a glowing tribute to his late Chief of Staff, Abba Kyari, who died on the 17th of April 2020 at the age of 67 from complications relating to the coronavirus, describing him as a true patriot, a loyal friend, and a compatriot in the last 42 years. The president, who went down memory lane, notes that his early contact with the deceased was when he was in his 20s as a student, then pursuing knowledge at Warwick and the University of Cambridge before coming back to Nigeria to begin serving. President Buhari notes that even at the time, Abba's true focus was always the development of infrastructure and the assurance of security for the people of this nation. He served so faithfully, noting that without both in tandem, there can never be a Nigeria people so much desired to have. In political life, Muhammadu Buhari was quick to note that Abba Kyari never sought elective office for himself. Rather, he set himself against the views and conduct of two generations of Nigeria's political establishment who saw corruption as an entitlement and its practice a byproduct of possessing political office. Becoming Chief of Staff in 2015, the late Kyari did not show any interest in publicity or personal gain to implement the agenda of the new administration, describing such a behavior as rare. He recalls with admiration of how the late Chief of Staff worked tirelessly 7 days a week, acting as a crucial gatekeeper to the presidency, ensuring no one, whether minister or governor, had access beyond another, ensuring that all those representing and serving the country were treated equally. While condoling with the loving family he left behind, President Buhari extends his heartfelt sorrow over the passing he calls of a true and dear friend. Meanwhile, Vice President Professor Yemi Osinbajo and his wife, Dolakbo, sent sympathies to the President, Mrs. Kulu Kyari, and the children, as well as members of the family, on the passing of the late Abba Kyari. A statement by Laolu Akande, Senior Special Assistant to the Vice President on Media and Publicity. Yemi Osinbajo prayed the Almighty to comfort the bereaved. Similarly, wife of the President, Aisha Buhari, in her official Twitter handle, condoles with Mrs. Kulu Abba Kyari and the entire family of the late Abba Kyari over the death of their husband and father, while praying God to grant the departed eternal rest. Mrs. Buhari also prays for quick recovery of those infected by the virus and an end to the COVID-19 saga. President Muhammadu Buhari has received several messages of condolences from foreign and national leaders on the death of his late Chief of Staff. Ruth Agwele has the package.
In a statement by the Senior Special Assistant to the President of Media and Publicity, Garba Shehu, the President received telephone calls from President Nana Akufo-Addo of Ghana and President Muhammadu Yusufu of Niger Republic. President Buhari also received similar messages of condolence from the embassies of friendly countries, including Egypt, Chad, and Liberia. He also received calls of condolences from ex-President Yayi Boni of Benin Republic and two former Nigerian heads of state, Generals Yakubu Gowon and Abdulsalami Abubakar. State governors have also sent in messages of condolences. Among them are Kaduna, Kogi, Borno, Kano, Zamfara, and Kwara states, as well as the former Senate President Ken Nnamani, the Sultan of Sokoto, Dr. Sahad Abubakar III, and the President of the Christian Association of Nigeria, Reverend Samson Ayokunle. The emirs of Kazaure, Najib Hosseini Adamu, Gwandu, General Muhammadu Ilyasu Bashar, retired, and that of Machina Alhaji Bashir al-Bashir Bukar, APC national leader Asiwaju Bola Ahmed Tinubu, the chairman of Zenith Bank, Jim Ovia, President Dangote Group, Aliko Dangote, and the executive secretary of the Lake Chad Basin Commission, Ambassador Mamman Nuhu, were among the early callers. Calls to the president were also received from Sheikh Dahiru Bauchi, former ministers, Senator Udoma Udo Udoma, and General Ike Umaru Sanda Uwachuku, Senators Monsurat Simonu and Kabiru Marafa, as well as Pastor Tunde Bakari.
Edo State Governor Godwin Obaseki has mourned the death of the Chief of Staff to the President, Abba Kyari. In a statement by the Special Advisor to the Governor on Media, Kurusu Sagi, the Governor said he received the news of the passing of Abba Kyari with sadness, stating that his passing is a personal loss and he will be greatly missed. He prayed God to grant the family of the deceased and the nation the fortitude to bear the irreparable loss. And now to COVID-19 issues. As the pandemic rages and as confirmed cases rise exponentially, it is appropriate to reflect on the level of readiness to respond to emergencies. Agatha Egwari Ojo in this report describes measures and protocols established by government to check the growing pandemic.
Despite measures taken by government to curb spread, there has been a steady rise in the number of confirmed cases. In Edo State, schools, churches and other worship centers, as well as shops of traders of non-food items, have since been closed. Also, markets have been relocated to designated public schools premises to give way for fumigation and decongestion, while use of face mask has been made compulsory. There is also an increase in the number of isolation centers, with the 30-bed facility built within 12 days at the Stella Obasanjo Hospital Complex and additional sample collection centers in the state.
10 centers have been activated in Oredo local government area alone. These are the primary healthcare center and of course 4 private hospitals, namely St. Philomena Hospital, Faith Mediplex, Better Faith Hospital, and Safe Haven Hospital.
While the discharge of 6 out of 15 patients is heartwarming, it is not the time to relax. For instance, the crowd in most of the designated markets leaves one to question if the social distancing policy will ever be achieved. Also, the booming sales of locally produced face masks does not translate to actual use of it.
Maybe now I'll go and get my own. I have not bought my own.
That I just bought for garage. The thing don't wet for the sweat. Now I just come out so that I'll try to get another one.
As government provides necessary infrastructure and facility to treat cases, observers say citizens will have to do more by adhering strictly to medical advice to curb community spread of the virus. In Benin, Agatha Egwaruju, NTA News.
To discuss more on this is Professor Mohua Adeleye, a consultant in public health and community medicine, University of Benin Teaching Hospital. Good afternoon, sir.
Thank you very much.
So, sir, what stage has the pandemic reached now in the country?
All right, thank you very much. In Nigeria, we have gone far enough to say that, yes, we have advanced in the containment stage. What has happened is that as a responsible country, we were able to start the control measures early enough. The federal government, the state governments, and several other layers of control initiated several measures. Things could have been better, but as it is now, we can definitely say that we have stabilized in our control measures and we're on the right track. At this containment stage, Nigeria has done very well compared to many other countries.
So you're saying that we are really prepared for the possibility of this infection with the
yes. There was an initial stage where there were concerns as to our level of preparedness as a country. But right now, I think there is growing public confidence, and talking very pragmatically, the control measures are working. One of the major steps that the federal government has taken, along with state governments and some institutions, is that new test centers have been set up. Initially, we started with just 5 in the network, but as we speak, we have more than doubled that. Only recently, Lagos State announced 26 new test centers, and then several others are springing up across the country. And so with increased testing, more and more people are being identified who are asymptomatic or symptomatic but carry the virus. And that way we're able to ensure that there is isolation and therefore protect the larger public. So we're doing well.
Let's come down to Edo State now. This state, it has not recorded any new confirmed cases. It's been about, like, let's say a week now. What is the true situation? Is it that there are no new cases, or the testing process has stopped?
Okay, thank you. Tests are still going on. In fact, we have improved in testing in Edo State. Keep in mind here that before now we had only the ERA Specialist Teaching Hospital testing. But as we speak, added to that list, we already have the University of Benin Teaching Hospital partnering with Center of Excellence in Reproductive Health Innovation, CERI. Also, the Edo State government has acquired an RT-PCR machine. So at least 3 centers are operational, and a few more are going to be fully operational in the next few days. So testing has increased and is increasing. It is not that the testing has stopped. What has only happened is that I think the control measures are doing very well. People can do better, but so far, I think public behavior has been reasonably fair. Again, keep in mind that in Edo State, measures of control started much earlier. Health education, massive health education was launched into the public. The University of Benin Teaching Hospital led in that. Printed material and the media, including NTA, EBS, ITV, a lot of information went out, and so people have behaved pretty well. There is a lot of room for improvement, but Edo State has stabilized. There was an initial law, then they surged, then now it is stabilizing relatively.
Well, generally in the country, the rate of confirmed cases has continued to increase daily. How much will this challenge the infrastructure on ground?
Okay, thank you very much. Let's make this clear. The very fact that we're having more cases identified is more of a reflection of increased testing. Transmission is still going on, no doubt, but if you look at the mathematics of the new cases setting in, what has happened is that initially there was an acceleration. Next, the acceleration has dropped. In fact, we're hoping that about 2 weeks ago, with the initial acceleration in the number of new cases, we feared that we will be coming close to 400. But that means by now we should have exceeded 1,000 by the 1,000 cases rather by the initial projection. So cases are increasing, but the rate of increase in cases is dropping, though the number of cases keep rising. And we will keep having that pattern over time until we go through the containment period and enter the transition phase.
Okay, so sir, before we let you go, we can't enlighten people enough, we can't advise enough. As an expert, what's your advice to the public concerning this pandemic? Just briefly.
Okay, thank you. The first I want to say is that people should not panic. There's a lot of fear, and what fear does is that it weakens people's resolve to do what is right and avoid doing what is wrong. Fear enslaves. Fear even leads to frustration, and fear can make people just throw away all forms of control measures they could have put in place. So take off fear. Next, ensure good personal hygiene. Wash your hands with soap. and with alcohol-based hand sanitizer. Ensure good respiratory hygiene by maintaining social distancing at least 2 meters away from the next person to you. And ensure that you put on your face mask if you are looking after a sick person, and ensure too that as far as you can, educate people around you to do the right thing.
Thank you very much. That has been Professor Omohwa Adeleye, a consultant in public health and community medicine, University of Benin Teaching Hospital. Panorama continues shortly after this break. Ekiti State government has procured 9 ventilators for the treatment of COVID-19 patients, even as a new case of the virus was recorded. Commissioner for Health, Dr. Mojisola Yahya Kolade, disclosed this in Ado-Ekiti. Yemi Dalemo reports on the disbursement of conditional cash transfer to indigent persons and need for residents to cooperate with government to check spread of the virus.
The Commissioner for Health and Human Services, Dr. Mojisola Yahya Kolade, said the 9 ventilators will aid treatment of patients of COVID-19, noting that more measures are being carried out to prevent community transmission of coronavirus in Ekiti State.
We are just trying to source for more funds, more help, more money that will be put into an isolation center. I don't know if you are aware, there's a proposed 120-bed isolation center.
The distribution of the conditional cash transfer fund to vulnerable and poor Nigerians to cushion the effect of the lockdown in Ekiti State is being taken to grassroots at what levels? National Program Coordinator, Conditional Cash Transfer, Dr. Timotokwe Sinkayi, while monitoring the exercise, said the aim is not only to support the beneficiaries at this critical period, but to also make them self-reliant and contribute to national development.
The program is not just about giving money, it's about building capacity. So we build their capacity.
Elder statesman Are Afe Babalola, while commending the federal and the Ekiti State government, advocate for more measures to curtail coronavirus.
What I want the government to do is to reinstitute the whistleblower system. If you know that there is a foreigner coming in, let the government know.
The state governments appeal to residents to adhere with the precautionary measures against COVID-19, particularly the use of face masks during this pandemic period. In Ado-Ekiti, Yemi Dalemo, NT News.
Inmates of the internally displaced persons camp in Uhogwa, Edo State have received 200 bags of 50 kg rice from the National Working Committee of the All Progressives Congress, the APC. It is to help reduce the burden of feeding the over 2,000 persons in the camp. And Willie Okolo reports.
With over 3,000 persons living in the camp, the cost of living is always a challenge. So this gesture was met with gratitude. The initiative to give the bags of rice is to help alleviate the pains of the inmates, who they say are in the position they are, not by choice, but by circumstances.
They don't plan when we were born that they are going to be here like this. So we have to support them. Knowing fully well before this time, Comrade has already built a school for them.
It gives me a lot of joy to be here today, to be able to give to them.
So whatever relief, whatever assistance can be provided by well-meaning Nigerians would make their lives easier.
For the coordinator of the camp, Solomon Folorenshaw, this gesture came to them in the nick of time. The children also used the opportunity to appeal to other well-meaning Nigerians to assist them in other areas like medical care.
It came at a time we needed it, and there's jubilation at the center. Everybody is so happy.
We need all things that you brought for us, and it's only the Lord that can bless you.
Feel we are not forgotten. We feel that we are loved by everyone, but we still need help. We need medicine, we need medical kits.
As they took in the bags, they chorused their praises to the NWC. In Benin, I'm Leokolo, NTA News.
And now to security. 10 Boko Haram terrorists have been killed by troops of Sector 2 Operation Lafia Dole under a subsidiary operation called Kantana Jamilian. A statement by the Coordinator, Defense Media Operations, Major General John Eneche, indicates that the terrorists were eliminated in an encounter in Bruni Gari village in Gubai local government area of Yobe State. Major General Eneche notes that one gun truck, Dosak anti-aircraft gun, 3 GMPG guns and several hard drugs were recovered from the operation. The armed forces remain resolute and committed to end terrorism and enjoin the public to continue to provide information to the military and other security agencies. And that's it on Panorama from the Benin Network Center. We thank you very much for watching. Good afternoon.